April 12, 1955, Rackham Auditorium, University of Michigan. 500 journalists, virologists, and camera technicians sit in suffocating silence under the glare of Klieg lights. Dr. Thomas Francis Jr. stands at the podium. In his hand rests a sealed 113-page report containing the unalterable fate of a generation. In the front rows sits the scientific establishment, anchored by Dr. Albert Sabin. Sabin is a titan of mid-century virology. He built his career on an absolute, unyielding biological dogma. He watches the man sitting near the front, Jonas Salk, with a tight, anticipating smirk. To Sabin and the elite, Salk is not a scientist. He is a kitchen chemist, a rogue upstart operating devoid of intellectual rigor. Sabin waits for the sealed report to validate his arrogance. He waits for Francis to open the envelope, read the statistical death warrant of Salk's killed virus vaccine, and publicly humiliate the heretic. Millions of paralyzed children serve as the collateral damage of this academic blood sport. The suffocating tension inside Rackham Auditorium is merely a distillation of a much larger global terror. The silence in the room echoes the silence of empty playgrounds and drained municipal swimming pools 3 years prior. Summer 1952, the apex of the biological siege. The United States is locked in a state of absolute helpless panic. The enemy is microscopic, highly virulent, and perfectly adapted to human physiology. The poliovirus, a single-stranded RNA enterovirus. It does not negotiate, it does not retreat. In the span of a few sweltering months, the virus carves a path of neurological destruction across the continent. Medical authorities record 57,628 confirmed infections. 3,145 citizens die. 21,269 suffer acute, irreversible paralysis. The virus dictates the terms of American life. Local governments shutter movie theaters, quarantine neighborhoods, and drain public pools, fearing the water acts as a vector. Ignorance breeds hysteria. Desperate citizens spray towns with DDT. Panic drives people to exterminate stray cats and dogs in the streets, convinced the animals carry the contagion. Families seal their windows in the dead of August. Children are banished indoors. Nothing halts the viral advance. The biology of the assault is terrifyingly efficient. The enterovirus breaches the gastrointestinal tract. It multiplies rapidly in the lymphatic tissues of the gut. It breaches the bloodstream, crossing the blood-brain barrier to invade the central nervous system. The virus explicitly targets the anterior horn cells of the spinal cord. It hijacks the motor neurons, replicating inside them until the cells literally burst. Once the motor neurons are destroyed, the muscles they control atrophy and die. The brain sends commands to move, to walk, to breathe. The muscles cannot respond. Hospitals transform into factories of mechanical respiration. Ward after ward fills with the defining machinery of the epidemic, the iron lung. These 700-pound steel cylinders encase children from the neck down. They operate through negative pressure. A leather bellows attached to a motor pumps, back and forth, changing the air pressure inside the tank. As the pressure drops, the patient's chest expands, drawing air into the paralyzed lungs. As the pressure rises, the chest compresses, forcing the air out. The machines hiss and clank in rhythmic, deafening unison. Hundreds of them line hospital corridors. Inside the steel tubes, children lie flat on their backs, staring at mirrors angled above their heads just to see the room. For many, this 700-pound steel coffin is not a temporary treatment. It is their permanent habitat. A power outage means immediate asphyxiation. Nurses pump the bellows by hand when the electrical grid fails. The elite scientific establishment offers nothing but observation. Virology in 1952 operates under an arrogant, rigid orthodoxy. Sabin, Dr. John Enders, and Dr. Thomas Rivers dictate the rules of engagement. They maintain that the only way to build lifelong, neutralizing antibodies against a virus is to use a live, attenuated strain. A weakened virus that infects the host just enough to train the immune system without causing severe disease. This process takes decades of careful, painstaking cultivation. Sabin spends years passing the virus through different animal hosts, attempting to breed a weaker variant. He demands patience, he demands funding, he demands total obedience to his methodology. Every day the establishment waits, the death toll mounts. Iron lungs continue to roll off assembly lines. The march of dimes, bankrolled by millions of ordinary citizens dropping silver into collection cans, demands an immediate solution. The sheer volume of casualties renders the elite's methodical, decade-long timelines unacceptable. The establishment remains paralyzed by its own dogma, refusing to acknowledge any alternative strategy. They dismiss killed virus theories as biologically impossible. They mock anyone who suggests a chemical shortcut. The poliovirus exploits this academic hubris, continuing its devastating replication cycle through the nervous systems of the most vulnerable. The paradigm remains unbroken. The biological siege holds firm. Mid-century virology is not a meritocracy. It is a rigid aristocratic fortress. The gates are guarded by a triumvirate of scientific titans. Dr. Thomas Rivers at the Rockefeller Institute, Dr. John Enders at Harvard University, and Dr. Albert Sabin at the University of Cincinnati. They control the federal grants. They control the peer-reviewed journals. They control the academic consensus. And the consensus is absolute. True, lasting immunity requires an active viral infection. The establishment operates under a singular biological dogma. To defeat a virus, a scientist must deploy a living, attenuated strain. The virologist isolates the wild pathogen and passes it through dozens, sometimes hundreds, of animal hosts. Mice, rats, rhesus macaques. With each biological passage, the virus mutates. It adapts to the foreign animal tissue, slowly losing its lethal affinity for human motor neurons. The end result is a crippled pathogen. It retains just enough biological function to infect the human gastrointestinal tract and provoke a massive lifelong antibody cascade. But it lacks the strength to cross the blood-brain barrier. This is elegant science. It is also brutally slow. Sabin demands a decade. He demands 15 years of meticulous cultivation and mutation. Meanwhile, the iron lungs continue to stack up in municipal hospital corridors. In 1949, Dr. John Enders achieves a monumental breakthrough. He successfully cultures the poliovirus in non-nervous tissue. For the first time, scientists can grow massive quantities of the pathogen in laboratory test tubes without extracting it from the spinal cords of live, infected monkeys. Enders secures the 1954 Nobel Prize. He hands the virological elite an unlimited supply of biological ammunition. Sabin immediately utilizes the Enders method to accelerate his live virus cultivation. Any suggestion of an alternative strategic approach is biological heresy. To the establishment, a killed virus is useless garbage. A dead pathogen cannot replicate within the host. If it cannot replicate, it cannot generate a sufficient antigen payload to map the immune system. The elite dismiss killed virus vaccines as dangerous illusions that will leave patients entirely exposed to the wild virus. Jonas Salk possesses no elite pedigree. He holds no Ivy League tenure. He operates out of a cramped, subterranean laboratory in the basement of the Pittsburgh Municipal Hospital. He is 33 years old. To Rivers, Enders, and Sabin, Salk is a localized interloper. He is a technician, a brute force mechanic, devoid of intellectual refinement. Salk does not care about biological elegance. He cares only about the mechanical execution of the immune response. Salk theorizes a radical chemical bypass to the elite's entrenched dogma. The human immune system does not detect life. It detects geometry. When a macrophage encounters the poliovirus, it does not analyze the RNA replicating engine housed inside the pathogen. It scans the protein capsid, the microscopic geometric shell encasing the viral genome. The immune system maps the exact physical architecture of the antigens protruding from that shell. It then engineers specific IgG antibodies to lock onto those precise structural coordinates, neutralizing the threat. Salk realizes a profound mechanical truth. If you preserve the exact structural integrity of the protein shell while chemically obliterating the RNA core, the immune system will still react. You do not need a live infection. You need a highly accurate biological dummy, a ghost. Salk cannot fund this academic heresy alone. He requires an outsider with an equal disdain for bureaucratic timelines. Basil O'Connor supplies the capital. O'Connor is the former law partner of Franklin Delano Roosevelt. He directs the National Foundation for Infantile Paralysis, fiercely branded as the March of Dimes. O'Connor commands a grassroots financial empire built on silver dimes and quarters collected by millions of terrified parents. He answers to no university board of directors. He demands immediate mass-scale results to halt the rising body count. O'Connor surveys the virological establishment, registers their 15-year timelines, and bypasses them entirely. He redirects millions of dollars in foundation funding directly into Salk's basement laboratory in Pittsburgh. The elite reaction is visceral. Albert Sabin mounts a relentless public crusade against Salk. Sabin views immunology as a complex, dynamic ecosystem requiring the finesse of a live virus interaction. He views Salk's approach as crude chemical butchery. Sabin takes the podiums at international virology conferences and mocks Salk by name. He dismisses the Pittsburgh doctor as a mere kitchen chemist. Sabin argues that Salk's dead virus will only provoke a weak, temporary antibody response, leaving millions of children falsely protected and ultimately paralyzed when the wild strain strikes. Worse, Sabin warns that perfectly inactivating every single viral particle in a massive industrial vat is chemically impossible. He predicts Salk's brute force methods will inadvertently inject live, lethal polio directly into the bloodstreams of American children. Sabin positions himself as the sole guardian of scientific rigor. He waits for Salk to fail, confident that the biological laws of attenuation will assert their supremacy over a kitchen chemist's crude mechanics. Salk ignores the mockery. He locks himself inside the municipal basement. He begins gathering the raw materials for his chemical bypass. He does not select weak and safe strains to test his theory. To build an effective killed virus vaccine, he requires an overwhelming antigen payload. He imports the 3 most lethal wild serotypes of the poliovirus known to human medicine: type 1 Mahoney, type 2 MEF1, and type 3 socket. He brings the absolute apex of the biological siege directly into his laboratory. The kitchen chemist prepares to weaponize the pathogen against itself. The poliovirus is a masterpiece of biological efficiency. It is a single-stranded, positive-sense RNA enterovirus. It possesses no cellular structure, no metabolic engine, and no capacity for independent survival. It is a microscopic genetic payload encased in a rigid icosahedral protein shell. The virus enters the human body through the mouth. It survives the corrosive hydrochloric acid of the stomach and anchors directly into the mucosal cells of the pharynx and the lower gastrointestinal tract. Here, the replication cycle initiates. The viral RNA hijacks the host ribosomes, overriding cellular directives and forcing the tissue to manufacture thousands of viral clones. The host cell swells and ruptures. The viral payload floods the lymphatic system and breaches the bloodstream. This is the viremic phase. In 99% of human infections, the immune system detects the anomaly, deploys antibodies, and neutralizes the threat, resulting in a mild fever. But in the remaining 1%, the virus executes a fatal biological detour. It crosses the blood-brain barrier. It locks onto the CD155 receptors on the surface of the anterior horn cells within the spinal cord. It injects its RNA directly into the motor neurons, transforming the very tissue that commands human movement into a viral factory. The neuron inflames, undergoes rapid apoptosis, and dies. The neuromuscular junctions dissolve. The resulting paralysis is mechanical, immediate, and irreversible. To halt this microscopic machinery, Jonas Salk must fight a 3-front biological war. Polio does not operate under a single structural profile. It circulates in 3 distinct, independent serotypes. Type 1, the Mahoney strain, acts as the primary executioner, responsible for 85% of all paralytic casualties. Type 2, the MEF1 strain, and Type 3, the Socket strain, command the remaining neurological destruction. Contracting and surviving a Type 1 infection offers zero biological immunity against Types 2 and 3. An effective chemical weapon must neutralize all three simultaneously. Salk requires an astronomical volume of the pathogen. He establishes an industrial-scale biological harvest in the subterranean laboratories of the Pittsburgh Municipal Hospital. Utilizing the tissue culture breakthrough pioneered by the elite virologists who mock him, Salk's technicians extract and mince the kidneys of rhesus macaques. They suspend the biological tissue in medium 199, a highly complex synthetic nutrient broth containing precisely 62 distinct chemical ingredients, including specific amino acids, vitamins, and nucleic acid derivatives. Salk inoculates these cellular bioreactors with the wild lethal Mahoney, MEF1, and Socket strains. The virus rapidly consumes the macaque tissue, replicating exponentially. Within days, the nutrient broth swarms with billions of infectious viral particles. Salk filters the slurry. He extracts a pure, unadulterated liquid payload of the most concentrated paralytic pathogen on the planet. To the virological establishment, this concentrated liquid is an uncontrollable biological weapon. To Salk, it is raw material. He initiates the chemical bypass. He introduces a highly specific reactive agent, aqueous formaldehyde, diluted to a precise ratio of 1/4000. Formaldehyde is a brutal alkylating agent. Salk must operate on a microscopic razor's edge. If the formal concentration is too high, or the exposure too long, the chemical will denature the exterior protein shell, melting the geometric structure of the virus. If the geometry is lost, the human immune system cannot read the antigen map, and the vaccine is completely useless. If the formalin concentration is too low, live viral particles will survive the bath, and the vaccine will inject paralytic polio directly into the bloodstreams of American children. Salk seals the vats and places them in incubators locked exactly at 37 degrees Celsius. As the formalin solution saturates the viral suspension, it initiates a relentless chain of cross-linking reactions between the amino acids of the viral proteins. Salk mathematically tracks the exponential decay of the viral titer on logarithmic graphs. After 3 days at 37 degrees Celsius, the formaldehyde penetrates the outer shell and systematically obliterates the delicate, single-stranded RNA core. The viral genome is dismantled. The infectious particles drop below detectable levels. Biological replication becomes impossible. Yet, the outer protein capsid, the vital geometric shell the immune system uses for target acquisition, remains flawlessly preserved. Salk demands 10 additional days of incubation to guarantee absolute sterilization, engineering a mathematically unbreakable margin of safety. After exactly 13 days, the formaldehyde is neutralized with sodium bisulfite. The lethal virus is transformed into a biological ghost. It is a chemically paralyzed husk. When a hypodermic needle drives this inactivated suspension into human muscle tissue, it triggers a massive systemic alarm. B lymphocytes detect the foreign viral capsids. Macrophages consume the biological ghosts, presenting the viral antigens to helper T cells. The immune system registers a catastrophic three-front viral invasion. It immediately initiates the mass production of highly specific IgG neutralizing antibodies, calibrating them exactly to the preserved structural architecture of the Mahoney, MF1, and Socket strains. The IgG antibodies flood the bloodstream. When the actual wild poliovirus enters the host weeks or years later, it encounters an impenetrable chemical wall. The antibodies swarm the live pathogen the millisecond it enters the viremic phase, binding aggressively to the capsid and blocking the virus from attaching to the CD155 receptor sites. The live virus is blindfolded and handcuffed. It cannot bind to the motor neurons. It cannot cross the blood-brain barrier. The biological siege is terminated in the blood. April 12, 1955. Rackham Auditorium. The suffocating silence breaks as Dr. Thomas Francis Jr. clears his throat and steps to the microphone. The Klieg lights burn against the heavy oak podium. In the front row, Albert Sabin waits for the formal declaration of Salk's failure. He waits for the biological supremacy of the live virus dogma to be mathematically validated. Francis breaks the seal on the 113-page report. Inside rests the statistical autopsy of the largest, most rigorous medical experiment in human history. To prove the biological ghost could halt the siege, Salk had to subject it to an unprecedented clinical crucible. The virological establishment demanded absolute, irrefutable proof. Thomas Francis Jr., a brilliant and uncompromising epidemiologist, architected the test. He stripped Salk of all control over the data. Francis engineered a ruthless double-blind gauntlet known as the Poliomyelitis Vaccine Evaluation Center. The sheer logistical mass of the trial was a military mobilization. Between April and June of 1954, an army of 20,000 physicians, 64,000 school personnel, and 220,000 volunteers deployed across 44 states. They targeted the most vulnerable demographic, children in the first, second, and third grades. The polio pioneers. 1.8 million subjects entered the crucible. Francis divided the children into rigid statistical columns. 440,000 received injections of Salk's trivalent killed virus suspension. 210,000 received a placebo, a useless shot of colored water. 1.1 million more were rigorously monitored as an uninoculated control group. The vials were coded. Neither the children, the parents, nor the injecting physicians knew who received the biological shield and who received the water. Only Francis held the master cipher locked in a vault in Ann Arbor. The syringes drove the formalin inactivated virus into the deltoid muscles of hundreds of thousands of children. Inside their bodies, the macrophages consumed the dead viral geometries. The B cells read the architecture. The IgG antibodies flooded the bloodstreams. Then the nation waited. The summer of 1954 arrived, bringing the annual terrifying surge of wild poliovirus. The pathogen swept through the public pools, the summer camps, and the packed neighborhoods. It breached the gastrointestinal tracts of the trial subjects. It initiated the viremic phase. For months, Francis and his technicians tracked every reported fever, every paralyzed limb, every death. They drew blood from 40,000 children to measure the exact geometric rise in neutralizing antibody titers. They fed millions of punch cards into massive, humming IBM 704 mainframe computers to calculate the exact trajectory of the viral slaughter. Now, under the blinding lights of Rackham Auditorium, the IBM mainframes deliver their final verdict. Francis looks down at the report. He broadcasts the numbers into a battery of microphones wired directly to global radio networks. The statistics strike the room like artillery shells. The placebo group suffered the full, devastating wrath of the wild virus. The uninoculated control group paralyzed and died at standard epidemic rates. But inside the bodies of the vaccinated children, the wild virus slammed into an impenetrable chemical wall. The IgG antibodies successfully blindfolded the pathogen in the bloodstream. The virus never reached the central nervous system. The motor neurons remained intact. Francis reads the exact efficacy rates. Against type 2 MEF1, the killed virus suspension is 90% effective. Against type 3 socket, it is 92% effective. Against type 1 Mahoney, the primary executioner of the epidemic, the vaccine halts 60 to 70% of paralytic infections. The numbers are absolute. The biological ghost holds the line. Francis utters the phrase that instantly alters the trajectory of human survival. The vaccine works. It is safe, effective, and potent. The academic blood sport ends in a fraction of a second. The auditorium erupts. Sabin's unyielding live virus dogma shatters against the hard mathematics of Salk's chemical bypass. Salk's brute force mechanics did not just provoke a temporary immune response. They triggered a massive, systemic blockade. The elite virologists stare at the podium, their 15-year timelines rendered instantly obsolete by a man they dismissed as a kitchen chemist. Before Francis finishes his final sentence, journalists sprint down the center aisle, fighting physically over the lone bank of rotary telephones in the auditorium lobby. The Associated Press wire triggers. Factory sirens wail in Pittsburgh. Church bells ring in unison across New York, Chicago, and Los Angeles. In municipal hospitals, nurses weep in the corridors between the hissing iron lungs. Pharmaceutical titans, Eli Lilly, Park Davis, Wyeth, and Cutter Laboratories immediately throttle their industrial vats to maximum capacity, racing to pump millions of doses of Salk's formula into the national supply chain. The biological siege is broken, but the arrogant establishment is not dead. And within weeks, Salk's mathematically perfect margin of safety will face a catastrophic industrial betrayal. The academic establishment does not surrender to a kitchen chemist. Within days of the Rackham Auditorium announcement, the elite virologists mount a furious counteroffensive. Albert Sabin refuses to concede the biological superiority of the killed virus vaccine. He views the Francis field trial as a statistical anomaly. Sabin waits for the industrial scale-up to fail, convinced that inactivating trillions of viral particles with chemical precision in massive commercial vats is mathematically impossible. He expects Salk's brute force mechanics to fracture under the pressure of mass production. He waits exactly 12 days. April 24, 1955, the industrial betrayal begins. A physician in Chicago reports a paralytic infection in a newly inoculated child. Hours later, a report hits the wire from California, then Idaho. The pattern is geographically scattered, but biologically identical. Every infected child received a dose manufactured by a single pharmaceutical contractor. Cutter Laboratories in Berkeley, California. Salk's margin of safety was mathematically unbreakable, but only if the industrial execution adhered strictly to his draconian protocols. Cutter Laboratories bypassed the math. Rushing to meet the massive national demand, Cutter technicians scaled up production volumes and fundamentally altered the filtration process. Salk demanded multiple rounds of ultra-fine filtration to remove cellular debris before the formalin bath. Cutter used coarse filters, leaving microscopic clumps of monkey kidney tissue suspended in the vats. When the aqueous formaldehyde entered the suspension, it reacted violently with the exterior proteins of these tissue clumps, polymerizing them into an impermeable chemical seal. The formaldehyde could not penetrate the center of the debris. Inside those microscopic biological bunkers, the lethal type 1 Mahoney strain survived the chemical bath entirely unscathed. Cutter Laboratories shipped out 120,000 defective doses. The hypodermic needles drove the fully active, weaponized pathogen directly into the muscle tissue of American children. The viremic phase initiated immediately. The virus multiplied, breached the blood-brain barrier, and attacked the anterior horn cells. The results were catastrophic. 40,000 children contracted abortive polio. 200 suffered permanent, severe paralysis. 10 died. The Cutter incident instantly becomes one of the worst pharmaceutical disasters in American history. Albert Sabin seizes the catastrophe. He weaponizes the tragedy to reassert the dominance of the live virus dogma. Sabin bypasses the scientific journals and goes directly to Washington. He aggressively lobbies Surgeon General Leonard Scheel and the newly formed Technical Committee on Poliomyelitis Vaccine. Sabin argues that the Cutter incident is not a localized manufacturing error, but a fundamental biological flaw in Salk's methodology. He insists that chemically paralyzing the virus with formaldehyde while preserving the protein capsid follows a curved trajectory of inactivation, meaning live virus will always remain at the tail end of the reaction. He testifies that the killed virus program is inherently lethal and demands an immediate, permanent halt to the mass inoculation campaign. May 8, 1955, Surgeon General Scheel capitulates to the establishment. He suspends the entire national rollout. The delivery trucks stop. The industrial vats go cold. Sabin's live virus dogma regains its stranglehold over American public health. The elite watch the killed virus paradigm collapse, satisfied that the biological laws of attenuation have reasserted their supremacy. Salk does not engage in the political theater. He retreats to the raw data. He isolates the specific industrial variables that led to the cutter failure. He analyzes the filtration mesh sizes, the formalin concentration gradients, and the incubation timelines. Salk mathematically obliterates Sabin's curved trajectory theory, proving that viral inactivation follows a straight, predictable logarithmic decay curve if the fluid is completely homogeneous. He proves the chemistry did not fail. The industrial oversight failed. Salk writes a new, unyielding blueprint for biological mass production. He mandates dual-stage filtration, demanding that the viral suspension pass through a fritted glass filter before formalin is added. And again, exactly midway through the 13-day incubation cycle to break up any newly formed protein aggregates. He forces the pharmaceutical titans to adhere strictly to zero-tolerance quality control. The federal government reviews Salk's overhauled protocols. The math is undeniable. In late May, the Surgeon General lifts the suspension. The assembly lines roar back to life, now operating under Salk's draconian biological safety standards. The elite establishment watches in stunned silence as the manufacturing scales to millions of doses without a single microscopic breach. The biological shield holds. The numbers drop with the concussive force of artillery fire. Prior to the mass inoculation campaign, the national incidence of paralytic polio hovered at 18 cases per 100,000 citizens. As Salk's chemically paralyzed ghosts flood the bloodstreams of a generation, the virus starves. It finds no host. It cannot replicate. By 1957, the national incidence plummets to under 2 cases per 100,000. The iron lungs are powered down. The municipal pools refill. The biological siege of the 20th century is fundamentally broken, crushed under the sheer mechanical weight of a mathematically perfect chemical bypass. April 12, 1955, 10:30 p.m. Eastern Standard Time. The Klieg lights of Rackham Auditorium have powered down, but the transmission of the breakthrough shifts to a national frequency. Jonas Salk sits in front of the CBS broadcast cameras for a live television interview with Edward R. Murrow on the program See It Now. The national incidence of polio has just been fundamentally condemned, and the economic reality of the medical miracle hangs in the air. Murrow leans into the microphone and asks the defining question of the era: who owns the patent on this vaccine? Salk looks directly into the lens. Well, the people, I would say. There is no patent. Could you patent the sun? The calculation of that single sentence is staggering. Salk operates in a capitalist medical paradigm. Pharmaceutical titans calculate the killed virus formula at a market valuation of $7 billion. Salk forfeits every cent. He refuses to monetize the geometric ghost. He views the chemical bypass not as proprietary intellectual property, but as a mandatory biological shield for the human species. But the virological elite do not forgive heretics. The academic establishment extracts a slow, methodical revenge. Albert Sabin refuses to accept defeat. He watches Salk's formalin-inactivated virus systematically crush the American epidemic, dropping the infection rate by 96% in less than 6 years. Sabin leverages this newfound biological stability. With the massive domestic outbreaks neutralized by Salk, secures funding to push his live, attenuated oral polio vaccine. He bypasses American regulators and deploys 10 million doses of his live virus sugar cubes into the Soviet Union in 1959. Sabin's oral vaccine is cheaper to manufacture. It requires no hypodermic needles. It requires no highly trained medical technicians. Sabin aggressively lobbies the World Health Organization and the United States government, weaponizing Salk's own success against him. He argues that Salk built the initial wall. But only a live virus can achieve total global eradication. In 1962, the federal establishment replaces Salk's injectable ghost with Sabin's oral drops. Sabin claims the final victory. He writes himself into the medical textbooks as the architect of global polio eradication, deliberately minimizing the kitchen chemist who broke the initial siege. The scientific aristocracy ensures Salk remains a permanent outsider. The National Academy of Sciences is the absolute zenith of the American scientific elite. They induct John Enders. They induct Thomas Rivers. They induct Albert Sabin. They repeatedly, deliberately refuse to admit Jonas Salk. He dies in 1995, locked out of the elite fortress. His methodologies still openly mocked by the old guard as brute force mechanics devoid of intellectual elegance. The elite demanded elegance. Salk delivered survival. The virologists worship the slow, 15-year biological passage of the live virus, willing to tolerate the collateral damage of paralyzed children while they perfected their academic theories. Salks recognized that a burning house requires water, not a decade-long study on the thermodynamic properties of combustion. He hacked the immune system with aqueous formaldehyde and precision geometry. History ultimately invalidates the elite's arrogance. By the late 20th century, Sabin's live virus vaccine reveals a fatal flaw. At a rate of 1 in every 2.4 million doses, the weakened virus mutates back into a highly lethal, paralytic strain inside the human gut. Sabin's elegant biological solution creates vaccine-derived polio. In 1999, the United States federal government officially bans Sabin's oral drops. They return exclusively to Salk. The brute force, chemically inactivated ghost becomes the sole weapon deployed in the American medical arsenal, proving its absolute supremacy. The virological establishment guarded their prestigious journals and their exclusive academies. They kept their titles. Salk dismantled the terrifying machinery of the 20th century. The 700-pound iron lungs that once filled municipal hospital corridors by the thousands did not end up in museums. They were powered down, hauled into scrapyards, and melted into industrial slag. The suffocating terror of the biological siege was erased from the American consciousness, broken permanently by a rogue technician operating in a municipal basement, who proved that the geometry of survival is absolute.